Many hospitals and doctors' offices limited patient appointments and surgeries during the pandemic. And now a concerning side effect of the shutdown is emerging. With fewer screening exams, patient visits, and even surgical procedures, breast cancer care, including mammograms, took a hit. Delaying those appointments didn't just mean delaying regular breast exams. For some, it meant delaying preventative treatments, such as chemotherapy designed to keep cancer from coming back. Dr. Hillary Nash from HCA Midwest Health is here to remind us taking care of your breast health is a priority. Dr. Nash, it was alarming to learn of a sharp decline in breast and cervical cancer screening tests back in 2020. Tell us a little more about the decrease and how that impacts women's health.
You're right. We have seen a sharp decline in many of the preventative care services that people usually do yearly. Breast cancer screening with mammograms, breast exams with their physicals, our cervical cancer screening, colon cancer screening, all of those things took a sharp decline during the pandemic simply because people were scared to come into the doctor. And so because of that, we're picking up the pieces in a lot of these cases that were able to become more advanced since we weren't doing our normal screening. So trying to catch up on that is super important. You know, breast cancer especially, this is a cancer that is very treatable if it is caught early. And it is a cancer that once you wait too long and it gets to other parts of the body, then it becomes a whole different situation. So it's just essential for some women who are going to unfortunately have to deal with this issue to get screened so that we can catch it when it is curable.
Now let's review the guidelines for when women should get screened, and what about risk factors? What are some of those that women need to be aware of?
You know, there's a number of different risk factors and they all have, their own significance. But just to name a few, heavy alcohol use is a risk factor, being overweight is a risk factor. Of course, we know genetics and family history certainly plays in. When we had a baby or if we've had children, if we've been on birth control, if we've been on hormone replacement therapy, all of these things are significant risk factors. But I think it's also important to remember, I have lots of patients tell me that they don't have any of those risk factors and that they don't notice anything abnormal. And so they don't really know if they need to be screened. But many women are not going to have identifiable risk factors and they're not going to have a family history, but they still have sporadic cases of breast cancer. So this is important for all women to keep up on.
And what if I don't have symptoms? Can I delay a breast health screening?
The important thing to remember is that mammograms are able to pick up on things that other observations, exams, and risk factors don't pick up on. So breast cancer oftentimes starts out very small. It's not something you can feel. You have no symptoms from it. We have calcifications oftentimes in the breast that are the first signs that something abnormal is happening. And those things can only be picked up on imaging. And so oftentimes those early findings of those cancers that haven't gone anywhere yet, the only way to know about them is by imaging with a mammogram. So that's why it's so important to keep up on those recommendations.
Thank you, Dr. Nash. To schedule your screening today, go to hcamidwest.com.